So we'll wait for a couple of more minutes.
Yeah, I think a lot of people are joining now.
Joining in now. Okay, as people join in, I welcome each and everyone on this call to the fourth webinar in the webinar series for women health conducted by Niramai. As you know, Niramai has developed a new way of detecting breast cancer, which is radiation-free, no touch, no see. And now we also have a way of conducting this breast health test at home. You just need to call us and arrange for a home visit. Today, we are very, very glad to have a very, very noted breast surgeon, Dr. Nanda Rajneesh ma'am, to talk to us about the different aspects of breast cancer. As an oncologist and surgeon, she's going to take us through the deep technical and clinical aspects explained in a very simple and understandable manner for common people like us to figure out how does breast cancer occur and how can we all work together to prevent it as well as much as possible. Dr. Nanda Rajneesh doesn't need any introduction. She's really very well known in India, particularly in Bangalore. She is right now a consultant GI surgeon and breast surgeon at Apollo Spectra group of hospitals. She's also consultant in bariatric surgery and breast surgery in Sakra World Hospital. She's a medical director and advisor at Carer Group. She's board of advisors in IRILAC, medical advisor to 103T, and she's a huge mentor for us as well at Niramai. Earlier, she was a vice president of Neurosurgery Specialty, vice president at Colorectal Association, and an executive committee member of AMA-SICON. Dr. Nanda, ma'am, is an eminent surgeon with rich and diverse experience and distinguished academic record. She's established herself as a specialist in breast surgery, minimally invasive gastrointestinal surgery, laparoscopy, and surgical oncology. She has many degrees acquired through extensive training in surgical field. She's also a member of Royal College of Surgeons with technical skills in many workshops and so on. She has very keen interest in cancer surgery, and so she has actually obtained a special training in GI surgical oncology. And she has obtained this from TMH, Tata Memorial Hospital, Mumbai, as well as from Heidelberg University Hospital. She also worked as a surgeon in the breast cancer unit in TMH, Tata Hospital, Mumbai. And she is constantly sought out to upgrade her technical knowledge. And she's always up to speed on any new things that are happening in surgical oncology. She has many publications to her credit, and also indexed, and a lot of journal awards as well. She was selected as an international traveling fellow from Colorectal Associations of India, Travel Award at International Gastrointestinal Conference, Best Teachers Award in Karnataka State. And she has also organized many conferences as well. And there's a full book called Pink Hope, written by one of her patients, completely dedicated to Dr. Nanda ma'am. So please welcome me in inviting Dr. Nanda Rajneesh ma'am to deliver a talk on breast cancer, risk factors, and preventative measures that can be taken. She's extremely busy. She's just now reaching home just to be able to come on to this talk. Probably she's still on the way. So without much ado, I invite Dr. Nanda ma'am to enlighten us about several intrinsic details of breast cancer. Right in time to reach home, ma'am. Thank you so much. Ashwin, can you unmute Dr. Nanda ma'am? Okay.
Okay.
Yeah.
Can everybody hear me?
Yes, ma'am. Yes, ma'am. We can hear you. I'll run through the slides if you tell me.
How do I move the slides? Can I connect the slides myself?
Yeah, sure. Or I can just give you the control if you want, or whichever way.
Yeah, how do I take the control of it?
Yeah. You must be having now. Can you check?
Yeah, I know. Does it move if how do I move the slides?
Should move, ma'am. Can you try? Can you just accept the control?
Can you just give it again? I think, yeah. Okay. I did accept it. I said yes.
Okay. If,
Can you just keep moving the slides? It's okay. I can talk.
Oh.
Okay. I'll
Okay,
just say next and you keep moving the slides. You don't mind.
Sure.
Okay.
Sure, ma'am.
Yeah. Good afternoon, everyone. Thank you, Geetha, for presenting my introduction. And I'm sure everybody is curious to know what I'm going to talk about, because this topic is slightly different from regularly you hear about breast cancer. Most often we keep talking about breast screening, breast scanning. The Niramai group also is doing the same thing. Now, today I'm going to take you through on what exactly causes breast cancer. Okay, next slide. Next. Geetha, can you just keep moving the slides, because I don't know how to take control of it. I did it, but it's not moving. Okay, I'm so sorry. I think slightly will be interrupted in between, but I'll make sure you understand what I'm trying to talk about. We all know breast cancer incidence very high. So in their lifetime, go back to the previous slides. In their lifetime, all of us, all women, there's a 13% risk. That is Let us say if we are 100 women sitting here, 13 of us are likely to develop breast cancer. The reason being, women itself, we are at high risk of getting breast cancer. So now, how is this? Another 87% of the people, they don't get breast cancer. So have they worked towards preventing breast cancer? Have they done something that has not caused breast cancer to them? Because even they have breast cells, they have breast, and there is some reason which is influencing breast cancer only in 13% of the people. Secondly, if you see this slide, this is a very interesting slide, I always think. If you see this slide, at one time, we always used to talk about cervical cancer screening. So in my olden days, like, whole group of doctors and group of people used to come to all these villages, smaller villages, to screen all women for cervical cancer. That means screening prevented cervical cancer, screening detected cervical cancer at an early stage, screening prevented death of patients from cervical cancer. So the screening for breast cancer is giving more awareness. It is preventing cancer. Now that is what we want to do. Even Niramai group has come up with an equipment which wants to screen the patients for breast cancer and wants to bring more awareness to prevent breast cancer. This is what we are here for. So we go to the next slide. What exactly causes, next slide. Yeah. What exactly causes breast cancer? As you all know, breast cancer is always caused by genetic abnormality. Genetic abnormality doesn't mean that you have to carry this gene by birth. No. So genetic abnormality can come. One second, I'll just mute something. Okay. Genetic abnormality can come when there is a gene change. We call it gene mutation. Okay. So there are 5 to 10% of women who get breast cancer. Let us say you have 100 women with breast cancer. 5 to 10 women in that 100 women could be carrying a gene from their mother, grandmother, whatever, the first degree relative or second degree relative. So they're carrying the gene. There is already a gene abnormality present in them. But that doesn't mean just there is a gene abnormality doesn't mean they become breast cancer patients. We'll discuss more about these 5 to 10% of the patients little later on a different slide. Now, remaining 90% of the women do still get breast cancer because of genetic abnormality that happens due to external influence, wear and tear of the cell, and toxin accumulation, and so many of the risk factors that we are going to talk about. What are these risk factors in 90% of the women which cause breast cancer? So we'll go to them. Okay, next slide. Now, the risk factors are very simple. First three of them, if you see, being a woman, yes, because you have large quantity of breast compared to the men, and there is a lot of proliferation of the cells in the breast happening during the teenage and adult age group, and there is a lot of influence of cyclical hormones on these breast cells. So, being a woman itself, you can get breast cancer. As we age, all our body cells are prone for cancers. Okay, not just the breast cancer is more high than any other cancer in the body also. So next is family history. Yes, if you have a BRCA gene, if there is a BRCA gene present in the patients are due to genetic abnormality that's already inherited by birth. Then personal history of breast cancer. That means if a woman has a cancer on one breast, she needs to keep screening the other breast. Very, very important. So she can get breast cancer on the other side. Radiation to the chest and face. This happens for some of the diseases, especially diseases like Hodgkin's lymphoma. Lymphoma, I don't know whether you heard of that. So we radiate the chest wall to radiate the lymph nodes that are present in the mediastinum. So radiation to the chest wall and face for some other disease, we are radiating the face. The breast also gets in the meantime get exposed to the radiation. So and repeated tests like mammography is also exposing your breast for radiations. You should know that. Then changes in the breast. This is very common problem that I see in a lot of women. We call it fibrocystic disease of the breast. That is, there is a cellular change that is happening in the breast already before it becomes a cancer. This is what I'm going to highlight and concentrate a lot on in the subsequent slides, because my aim is to see what changes happen in the breast, and all these reasons changes can happen. Okay, race and ethnicity, being overweight, dense breast, vitamin D deficiency, smoking, chemical toxins, bacterial infections, hyperestrogenicity, diet, hormonal imbalance, lack of exercise combined multiple factors. So all these factors are going to be discussed what exactly happens at the cellular level in the breast. How developmentally from nothing in the chest wall, as when we are all born, there's just a tiny bud of breast. Next slide, please. Tiny, next slide, please. Can you hear me? Next, yeah.
Yes.
Okay. Now you see this is a normal anatomy of the breast. Okay, this is a normal anatomy. You should all know this is a normal anatomy of the breast. So when people come with a breast problem, they think breast is filled with fat and it is very beautiful, and it's not just a beauty structure. There are a lot of glandular structures inside the breast. These glandular structures and the primary cellular unit in this glandular structure is very, very important. And this is under the influence of hormone round the clock. You see here the round structure, that is a single cell, that's a final glandular cell, single cell. This is one single cell which is called A, what you call it. That cell can get mutated anytime and can get converted into cancer. So this whole, let us focus on how at cellular level we are likely to get breast cancer. Next slide. Now we start with the development of the breast, the ductal tree. So this is a final product. This is a breast. Just keep sliding. 4 clicks, 4 clicks. Yeah. Okay. Yeah. Okay. All right. Now you see at birth, it's a very small breast there. Okay. There's one just a bud. Normally in men also, it will be only this much. Even men have breast tissue. You should know that. Developmentally, we have a nipple, areolar complex, and we have a breast tissue. We all. But the number of cells, they keep increasing by proliferation. That's called multiplication of the cells. The proliferation, it's a medical word, because the same slide is I am using it even for the doctors. But here I'm going to use for you as much as possible the non-medical terminologies to simplify it. The cells are going to become multiple, many more cells, and it becomes a nice breast by puberty. So this is a phase when there is a lot of influence of hormones happening. Where are these hormones coming from? From the brain, actually. From the brain, pituitary gland, and then the ovaries and the uterus and the breast. They all start simultaneously developing. Why this happens? They are trying to prepare a girl to become pregnant, to have a child. Okay. Simultaneously, body is preparing the women's body to have children. This is a natural phenomenon. Okay. And during pregnancy, there is not only proliferation. That means ducts are multiplying. They are becoming bigger and bigger cells, but they're also getting little enlarged and making a space for the milk to get produced and making the space for the milk to be. This is happening because there are some of the pregnancy extra hormones coming into the picture, and there are some hormones getting removed from the picture, because cyclically we are all under the influence of estrogen and progesterone, but there are many more pregnancy hormones coming into the picture, which is causing not only proliferation but also differentiation. Next slide. So if you see, this ductal system is not just a simple ducts like that, ducts and glands. So it's a bunch of grapes, the ductal system is like a bunch of grapes. So there are different types of lobules that are present. Initially, when the proliferation is not much, it is just a type 1 lobule. Then multiple cells are less. Then the cells become more, branches become more, glands become more, and they're ready to produce milk, that is type 4 cells. Okay, that happens in pregnancy and lactation. Next slide. So now this is a normal cells. You see, this is a normal cell cut open. Then this is a atypical ductal hyperplasia. Okay, there is a component called fibrocystic disease of the breast. So this is what is happening. Atypical cell formation is starting. That atypical cell can become ductal carcinoma in situ. That means the cancer is sitting in one area and it's not able to spread. It is sitting in one area. That is a pre-cancer condition. Same thing. Even in cervical cancer, we started picking up early cervical cancer, in situ cancers, cervical carcinoma in situ, CIN1, CIN12, CIN3. So we started picking up CINs, means cervical in situ cancers, means it is not able to spread. It does not even become cervical cancer. That time, we don't have to remove the whole of the uterus. We can just only do a cone excision of the cervix. So by doing this, we prevented actual cervical cancer. So we want to pick up changes in the breast at an early stage. Ductal carcinoma in situ and early breast cancer is what we want to pick up by doing a breast cancer screening. Okay, so Like in colon cancer also, if you see, for even a lot of us, we also advise colon cancer screening. That is, you do a colonoscopy to pick up polyps in the colon. So it is always adenoma, polyposis, and cancer sequence. Like that, here in breast cancer also, normal breast, atypical ductal hyperplasia, ductal carcinoma in situ, and invasive cancer. Invasive cancer is proper cancer which spreads. Next slide. Next. Okay, now we talked about what are the changes that are happening in the breast, normally and pathologically. Pathologically means disease types and non-disease type. So continuously, breast is under the influence of many imbalances because of the hormonal pattern that is going on. Cyclical hormone influence is there. Pregnancy is happening, and proliferation and differentiation is happening. Okay, if all this happens with the normal food, normal hormones, normal environment, no genetic shift in the cells, then it is a normal breast, you don't get breast cancer. But not all of us are lucky. 13 of the 100 people can develop cancer cell formation process. That means abnormal cell forms, okay, which I like to use a word high risk cell formation. And then this high risk cell has to get mutated into a cancer cell again. So first is the benign cells, benign abnormal cell, means it doesn't have capacity to spread, but it has capacity to multiply. So once it becomes a high abnormal DNA material, that abnormal DNA material produces certain factors which will allow this cancer cell to spread to different parts of the body. Okay, process of development of the breast cancer. Next slide. So now this process of development of breast cancer happens when there is an imbalance. You all know the world is full of balancing and imbalancing, right? We have Brahma who gives birth to the whole world and universe and children and people and everything. Okay, and you have a Vishnu who maintains it in a normal pattern, tries to make it as normal as possible in both the ways, behaving positively and negatively. And you have Vishnu who is a destroyer. Like that, my body should have a balance of both proliferation and differentiation. More proliferation is also not good, differentiation also not good. There has to be that you have to have a destroyer also in this world where the bad things have to be destroyed. Like that, if my body has a cancer cell development, I have a capacity to kill that cancer cell. So which we call it apoptosis, self-killing of the cell itself. Okay, my body can kill the bad cells, so it is called apoptosis. So there is always a destruction and production taking place everywhere in the world. So there has to be balance. This balance is called yin yang theory. There's a positive force and there's a negative force. In the whole universe, there are two forces which is keeping it balanced. When this is in imbalance, there is a problem creating that. Until the balance develops. Okay. So that balance can come positive direction, that balance can come in the negative direction. All right. Next slide. Okay. Now just click it. Click all the 4 slides. Click all the 4 slides. Yeah. Okay. Stop. Okay. Now there is a stage of development of cancer formation, as I said. Let us say there is a normal and specialized cells. Okay. Then it proliferates, means it keeps multiplying. In the process of this proliferation, one abnormal cell formed. You see that red dot is an abnormal cell. That red dot is an abnormal cell. Okay. It formed, but it did not still become cancer cell. This could be just an atypical cell. This atypical cell, under the influence of so many risk factors I talked about, which I'm going to talk in detail again, it can multiply and become a cancerous cell in this last 4th cell. Let us say if the proliferation is very high. See, there are certain factors which increase the proliferation. Let us say this initiated cell doesn't multiply at all, because if estrogen is very low, my breast cells do not multiply. Our breast cells do not multiply. So this one single cell is there, it will get killed by itself. That is auto killing. If the estrogen influence is very high, I'm giving you one example of estrogen, but we'll also talk which are all the promoting factors. We'll talk later, because the risk factors are nothing but the promoting factors and progressing factors. So then it becomes a benign tumor. Then that multiplies. So we have a condition called fibrocystic disease of the breast. You have cyst in the breast, fibroadenomas in the breast, phalloid tumors in the breast. Okay, or typical simple or typical cells, adenosis in the breast. Okay, so that multiplies if there is a high proliferation. But if there is a Okay, just go. I don't disturb. Sorry. So if it multiplies and if there's a mutation happening, then it becomes a mutated cell. And that mutated cell, whatever you do, it doesn't have a control. Whether there is proliferation, no proliferation, it'll keep growing, because any mutated cell with when it becomes a cancer cell, complete activation of the cancer cell has happened. Nothing can stop it, because it can only keep growing, because that is a characteristic of a cancer cell. That's a progression of the cancer cell. So there are certain factors which lead a benign tumor to a progression into a cancer tumor. Okay, so I have, at every level we can put a stop by preventing breast cancer by certain factors. So we'll discuss about that one by one. Next slide. Next. Next. Yeah. Now, let us say you have already a mutated gene. Okay, you might have this mutated gene, carcinogen. That's a red gene that you're getting. That red gene. Yeah, that's a mutation. This mutation you may be carrying by birth. Okay, we call it BRCA1 gene, BRCA2 gene. Or this mutation could have happened due to external influence, like high estrogen conditions, like smoking. Smoking has some carcinogens, or like radiation. External radiation. I told you in Hodgkin's lymphoma we give radiation to the chest wall. Radiation. All these conditions will cause mutation of a gene. Any toxins in the body will cause mutation of a gene. Once that mutation happens, my body has a capacity to kill that mutation unless it is genetic. So, because we have something called autoimmunity, this is called cancer immunity. So, if that cancer immunity is present and the proliferation is very less, then that mutated gene will get killed. You only have a normal cell. Whereas if proliferation is very, very high, so when does this high proliferation happens? One, in premenopausal time, as it is, there is high proliferation, but excessive proliferation happens when there is high estrogen in the body. There are a lot of hyperestrogenic conditions in the body. Being fat itself, you become hyperestrogenic, which I will discuss later. Now, doing excessive activity, physical activity, it creates a hyperestrogenic condition. And not becoming pregnant, it creates a hyperestrogenic condition. So this causes something called high proliferation. So the carcinogen, that cancer gene, will multiply to multiple high risk cells. So more the high risk cells in the breast, more the chance of getting breast cancer. It's like an arrow. Next slide. Next slide, please.
Yes.
Yeah, it's like, arrow trying to hit. Arrow is nothing but again another carcinogen. It's another high risk factor trying to hit these breast cells. So if you have more high risk breast cells, there's a more chance that this arrow will go and hit. That is, they call it bullseye. I don't know how many of you know about that. If the bullseye is big, you can easily hit that area. So the carcinogen can hit the high risk cells easily, cancer progressing it into cancer cell. That progression of cancer happens if this arrow reaches these high risk cells. So one is, what do you do when you prevent breast cancer? Avoid having more high risk cells, one thing, and also avoid having this arrow, avoid having carcinogens in the body. So in these two ways you prevent breast cancer. Next. Yes. Yeah. We'll go to the next slide. Yeah. So now, this is a very important, interesting slide. So if you become pregnant, the proliferation comes down, because in pregnancy, instead of proliferation, there is more of differentiation. So pregnancy gives rest to these proliferating cells, and pregnancy gives kind of rest to these high risk cells. So because this high risk doesn't multiply into many cells, there is a lot of time to kill that high risk cells. So that's why we say pregnancy and childbearing and lactation protects the breast from breast cancer. We should all know this is a reason. Second reason, what happens in pregnancy is the estrogen effect is not there on the breast at all. So that proliferation is also not there. So that is, promotion factor is also not there. That's the reason. Now, if you take nulliparous women, next slide. So in a nulliparous woman, if you see, the influence of all these factors in very high. No regret. High risk cells remain the same. They never decreasing in number. After menopause, the estrogen effect is gone on the breast. So they decrease. Okay. Can you hear? There's some internet.
Yeah,
Hello?
your voice is breaking, ma'am, a little bit.
Can you hear me?
Now you can hear. Now we can hear you, ma'am.
Oh God.
It's fine, ma'am. It's fine. We
Can
can
you hear me, Geetha?
Yes, ma'am. Yes, ma'am. We can hear. We can hear. Yes, yes. Ashwin, can you also say? We can hear you, ma'am. You're fine. Hello? I think we lost her. Just a minute. Ashwin, can you hear? Hello, ma'am? I think we lost her a minute. Okay. So we'll wait for some time. I think. Okay, she's back. Ashwin, can you unmute everyone? I think she won't be able to come back. Ashwin, can you unmute? Ashwin? Ma'am, can you hear me? Ashwin, can you pick it up? I'm not able to. Yeah, I'm not. Mine is stuck here. Can you do a... Hello, ma'am. Can you hear me? Sorry for the trouble. Ma'am, please continue. You can share. Can you hear me? Yeah.
I got it. Till when you could hear me well?
Now we can hear you. Ma'am, you want to share this slides yourself?
I don't know how to do that. If you can do that,
Okay.
it's share the screen.
Can you give?
Yeah. Okay. Share the screen. 1 second, like that. Desktop. How do I share the desktop?
Yeah, you can just share screen.
Share.
And
Share the screen, but the
yes.
desktop is not this one. Like the Safari,
Or
launch meetings. Like that. No. Files. Yeah. Desktop. It's
sorry,
not going there.
apologize for this confusion. There is some problem.
I think problem from your side only. No.
Yeah, maybe from my side also. Ashwin, can you take control? I'm not.
Yes, I have taken control.
Yeah.
You both are unmuted. Dr. Geetha, you would have to share the screen like last time.
Yeah.
Yeah, Ashwini, you can share the screen too. Actually, till when you could hear me, I want to know that.
We could hear you.
I think
You could
we
hear
heard
me
you
till the last.
till progression.
Slide 27, ma'am. Slide 27.
Yeah.
Ashwin, can you share? Because there is some problem here. I'm unable to.
Events during a woman's lifetime. That's where I think we lost you.
Can you share the slide, Ashwin, please?
Yes, just give me a second.
Yeah.
Just. See, everybody watching this, we apologize for all these issues that we're facing.
Yeah. Sorry, guys.
Yes. Where did you keep moving? Yeah, backward, go back. Yeah, from here, right? Geetha, is it from here? I can't hear Geetha. I can't hear you. Okay, all right, no problem. Can everybody hear me, Ashwin?
Yes, ma'am. We can hear you.
All right. Okay, then go back to previous slides. Okay, now the issue here is we were discussing so much about in pregnancy, there's a protection. And if the woman doesn't become pregnant, that means nulliparous women will call. The influence of estrogen hormone is very high, so they can get breast cancer. Now, issue is, can we prevent breast cancer? Yes, we can prevent breast cancer. We will go from genetics part. Okay, let us say we all inherit this gene which causes breast cancer. Okay, so we call it BRCA1 gene and BRCA2 gene, and there is something called single nucleotide polymorphism happening in these genes. Next slide. So when there is a gene present in the family, so in that family, we call the whole family, women in that family will be called high risk families. Who are these high risk families? Multiple relatives with breast cancer, early age at diagnosis. Let us say I have a sister who is youngest in age, I mean maybe 25, 30-year-old. She is with a breast cancer. Even though none of my mothers and grandmothers did not develop breast cancer, I still may be at risk of breast cancer because she has a genetic change, so she has developed a cancer at an early age. I have a chance. Okay, multiple diagnoses in the same cancer, very important. And male breast cancer, Jewish ancestry, presence of associated cancers, particularly ovarian cancers. Okay, next slide. These are high risk families. So when you find high risk family, let us say Geetha wants to go and evaluate who I should do definitely a screening every 3 months or 6 months. Or should we really do genetic testing in these patients? So you can you can do a strict screening in these families wherever there is a high risk in whichever families. Okay, so how do we find out, identify that there is a genetic change? By doing a genetic test. So what does the genetic test help? By doing BRCA1 and BRCA gene, it guides the decision about the management and screening, and it avoids unnecessary screening and relief and less certainty. Okay, once I have BRCA negative, I know I have a less chance. But if I'm BRCA1, BRCA2 positive, I know for sure one time in my life I'm going to get breast cancer. Then I start thinking, is there a way I can avoiding certain risk factors? Also by taking care of myself with more frequent screening to detect the cancer if it is going to come to me at an early stage. And ability to help family members also. Once I know I'm BRCA gene positive or negative, I know what to do my other kith and kin also. So these are the potential benefits of doing a genetic testing. Next slide. So once I find out I'm BRCA positive, what are the options that I have? One is, straight away I am going to get breast cancer 100%, I know, so remove the breast. Okay, that's an option. So a lot of countries, they are definitely doing this. We know very famous Angelina Jolie's, yeah, huge marketing gimmick that, big implants and all that. Yeah, okay. But I don't think any of us will agree to do this, right? When I was discussing to my friend, hey, bilateral mastectomy, she said, okay, these patients have got oophorectomy chance. Will you do oophorectomy also? Or will you do remove the colon also? Because they are also likely to get colon cancer. So what all you're going to remove? Oh, so you can do what is called as one is chemoprophylaxis or prevention. That option is present. If that is there, you meet your doctor, he knows or she knows what to do with chemo prevention. And risk factors also should be suppressed as much as possible. And there are certain strict screening guidelines. You do screening more frequently. Next slide. Okay. So now next is, now we talked so much about risk factors. Now I'm going to talk to you about each of these risk factors. Just open all the sentences in the, yeah, better till then. Okay. Now estrogen, we talk a lot about estrogen, right? Where is this estrogen coming from in our body? It is coming from the ovaries itself every month. The ovary, before it breaks, the estrogen is produced from the ovary, and the estrogen is again stimulated and produced because there is another pituitary hormone coming from the brain. So this is a normal cycle estrogen I have in my body. Okay. Once the ovulation starts, the progesterone will start coming. Before that, estrogen is there. So first 15 days of our life, in our cycle every month, first 15 days you have estrogen, and next 15 days you have progesterone. Okay. Estrogen acts with other reproductive to increase in the proliferation of the breast. So we know proliferation has got a negative effect if there is an abnormal cell. Let us say you have a high risk cell in the breast, too much of proliferation is not good. So actually estrogen has to be just normal. There has to be only proliferation should be present in the breast. Too much is not good. That yin yang imbalance will start, right? So when that too much will happen? When you take oral contraceptive pills. When you're obese, because obesity is known to produce estrogen-like factors. And there are certain hyperestrogenic foods that contain, we'll talk about it later in diet when I'm discussing. Hyperestrogenic foods. So when you take, when any of these influencing factors of, and not becoming pregnant itself, and early menarche and delayed menopause. So long exposure of estrogen. So what this does, this increases the tumor promotion. That means tumor that is an abnormal high risk cells keep multiplying more, numbers are more produced. And there is a decreased time for mutation and repair. Increase in number of cells at risk. The multiplication also happens. Estrogen also directly promotes the tumor formation, okay? So both the things it does. It promotes tumor cell formation. It also increases the high risk cell formation and decreases the mutation repair. How does this tumor promotion happens? Not only estrogen influences in proliferation, it also gets divided into certain carcinogen-like products. That means if you're taking oral contraceptive pills, which contain high estrogens, they can produce a byproducts which are like a toxins, and they can irritate your breast cells to get converted and mutated into breast cancer cells, leading to initiation to cancer also. That means estrogen is very dangerous thing in our body. High estrogen is not good. Where are we giving this estrogen? One is oral contraceptive pills. Also, in postmenopausal women, they use hormone replacement therapies. Nowadays, they mostly use progesterone, but they were using at one time high estrogen. So that caused a lot of breast cancer patients at one time. So, next slide. You understood, right, about estrogen? Now, how is the risk factor increased? One is large number of mutations, increases initiation and progression, greater level of proliferation. So estrogen does this, okay? And then increases number of cells at high risk to become breast cancer, increases the time of high risk for tumor initiation. Okay, next slide. Now, obesity. Next thing is obesity. Now we discussed about estrogen. Estrogen causes breast cancer. What does this obesity do? Obesity does many things. Obesity means there is a normal functional cell, there are a lot of fat cells sitting around each normal cell. Okay. The obesity means I'm fat doesn't mean fat is just sitting just below the skin. It's sitting between every individual functional cell. That means it is making the original cell tired, it is changing the immune system in the body, and it is also producing certain factors. The fat cells is known to produce certain factors, okay, which can irritate the normal cell. So they are like inflammatory factors. And also obesity also is known to cause the production of estrogen like factors, or it causes hyperestrogenic condition. That's directly and indirectly. I will not be going into depth for you how this estrogen comes in fat people, but this much is enough. Okay, next slide. Next slide. Next. So obesity is associated with, actually this is a funny thing here. Go back to the previous slide. It is associated with a decreased premenopausal breast cancer. Okay, this is a little funny because it interferes with the regular menstrual cycling. That means regular hyperproliferation is reduced. Okay, so So there is less proliferation, more time for repair. And it is associated with increased postmenopausal breast cancer. Means if you have more fat after 45, 50, there's a very high risk of getting breast cancer. Increases estrogen exposure, and fat cells from the estrogen, fat cells, they form estrogen-like factor. I said that. So is known to cause breast cancer. Okay. Next. Physical activity may be associated with the decreased breast cancer risk for women of all ages because it acts by changing menstrual activity itself. That means there is a regularity of period cycles. Exercise increases the age at menarche. You know what? The the olden days, the now see a lot of children, they watch TV. You know, they sit in front of the TV. So their physical activity is so less. That's why early menarche is common. Early menarche is common even in all these young girls because of many other reasons like diet factors and exogenous hormones, we call it. Breast milk is containing a lot of hormones nowadays. Cows are given hormones to get more milk, so that is coming here. And then so okay, so that the cows to increase milk is coming and stimulating this girl's body, and so early menarche is quite common. Okay. Now, body characteristic also changes in with physical activity. Exercise can decrease the body fat levels again. Hormones also gets regularized, and with the regularity, there may be decrease in the estrogen levels also in the body. Okay, next slide. Vegetables and fruits is known to cause a lot of positive factors. Eating large amounts of vegetables may be linked to small decrease in the breast cancer risk itself, because there is no direct evidence till today. A lot of n numbers of papers have been written, but there is no exact direct connection. They're not able to find out. But there is a very strong stronger decrease in the risk with the dark green and colored vegetables. Any cancers, not just breast cancer. It is very proven. People who live on a vegan diet, they are known to get less risk of many cancers, including colon cancer. Vegetables may have a greater effect for women with a family history of breast cancer, and eating fruits in general is unrelated to breast cancer as such. Okay, next slide. Phytoestrogen is known to prevent any cancers in the body. Fast, the slides you go fast, okay? All right. So why these vegetables, fruits prevent breast cancer? They are known to block carcinogen activation by increasing flavonoids and isoflavonoids, coumarins that is needed for body, enhance the carcinogen detoxification, antioxidants in the plants, because it is we know that gut system is one of the biggest immune system in the body. A lot of vegetables and fruits is known to detoxify your body better. And it also vegetables and fruits is known to increase DNA repair. Okay, so the mutation it is going to prevent. That's what we think. Especially the selenium and polyphenols in the green tea is also very helpful, they say. Next slide. Next. Okay, next. Keep going. Okay. Um, all right. Phytoestrogens. There are certain chemicals in the plants, soya products, which can produce estrogen like phytoestrogen products, they call it. So there are some studies showing eating phytoestrogen can increase the risk of breast cancer. So they have to be avoided, certain foods. But there are very conflicting data that is present on them, positive, negative, both of that. Whole grains is very good. Next slide. Whole grains is very good. And fiber diet is very good, because I think ultimately diet is going to influence the gut to increase immune system in the body, which is known to increase apoptosis in the body. Self-killing of the death of a normal cell increases with the diet. Next slide. Next.
Meat and fish.
Geetha, next slide.
Dairy products.
Dairy products. Dairy products, I said there are a lot of conflicting data on dairy products, dairy fat also. But nowadays, because of exogenous hormones that is present in all the dairy products, I think it can cause progression into fibrocystic disease of the breast, which is very common these days. So it is very important we use organic dairy products than using this regular dairy products. So I would say avoid taking dairy products which contains a lot of these hormones, and even non-vegetarian red meat should be avoided. Next slide. Okay, smoking actually increases the risk of breast cancer, but in heavy smokers below the age of 20 have only 30% increase, but above the age of like above 40, 50, that is postmenopausal patient, 80% increase in the risk factors. How the breast cancer happens in tobacco smokers is cigarette smoke is known to contain numerous chemicals that nicotine breaks into certain products which can irritate. It becomes a toxin, irritates the primary breast cells, and so it can cause breast cancer. Next slide. Alcohol use, yes, long term alcohol is known to actually suppress immunity, so it causes breast cancer. And alcohol increases estrogen levels also in the body, because why it increases, estrogen is supposed to metabolize in the liver, but alcohol is taking that place of metabolism. So estrogen inevitably estrogen levels increase in the body because they are not getting metabolized and removed from the body. So estrogen level increases in the alcoholism, so directly and indirectly alcohol increases. Alcohol also takes away folic acid, which is helpful in normal proliferation and differentiation of the breast cells. So alcohol takes away the folic acid. B deficiency is very common. That can also cause breast cancer. Okay, so alcohol has both direct and indirect influence. So if you see this slide, it's a very important slide. Click everything. Click. Yeah. Okay. Now this is a very interesting slide. I like to show it to everyone. Now, decrease in the cells at high risk happens at childbirth, and that is pregnancy is going to decrease the cells at high risk because pregnancy gives a lot of time to kill the unspecialized cells. Okay, and diet is also known to help. And decrease in the initiation process happens by minimal exposure to all toxins, chemicals, radiations, childbirth, diet, and avoiding the radiation exposure. Yes, and then elimination of the initiated cells. Next, click. Yeah, by childbirth and diet, and decrease in the promotion process with decreasing estrogen exposure and childbirth. Next, click. And diet and physical activity. Okay, next slide. Next, I think you have to click one more here. I can't say it. This way of so we are here because that's why Niramai brought you all here on this board to tell you, please do breast screening. Please call us when you find you have any of these risk factors and family history. As it is all women, every year we have to screen our breast. Or if you find any lumps and bumps, and if you have breast pain, okay, you have to screen your breast. That's one thing. But as such, all women, I'm totally normal, still I have to screen the breast. Breast screening is a way of finding the breast cancer at an early age and feel it. Screening only can take care of that. Okay. The first stage of breast screening is we used to do mammogram before. Now we prefer ultrasonography. But above 50 years, every 3 years, we normally do radiation mammography itself. That is standard of care. So we are yet to standardize this thermomammography very soon. I think that will also happen once FDA approval comes. But they are able to detect quite a lot of abnormalities in the breast through this equipment. So at least you know that you have to meet the doctor when you see any abnormality in the thermomammography. Yes, it is going to, and it is easy, you're not getting exposure to radiation also, because that was the biggest hitch when everybody was told you have to. And secondly, mammogram costs a lot of money, and you have to, the breast gets pressed in the radiation also, and you have to go to hospital only to do this. And some radiologist has to read the report. It takes 2-3 days to get the report also. And you have to pay for it. So early, and in America, USA, and many of these European countries, the mammogram, it's all done by the government projects. But here we have to pay for it. This is a reason not many people go for the screening techniques. And now we have an easy accessible technique to do a thermomammography to find out if there's abnormality. Then I know once you are detected to have something, then you have to be with the doctor further to find out what to do next. Okay. Next slide. And the examination by the doctor also is a must in the screening process. And the third part of the screening is self-breast examination. So you have to stand in front of the mirror every month on a particular day. 2 days in a row, preferably I would say 5th day of a periods, you stand in front of the mirror, then you check if there is something. Every month, if there's any change, please meet the doctor or do a screening test. And if you find something, then you have to. And also get yourself checked for vitamin D always, because vitamin D is one of the immune modulators in our body to prevent or suppress or increase the immunity of the breast cancer. It's increase the immunity to prevent breast cancer, okay, and suppress the proliferation of this abnormal cells also. If your if vitamin D is normal, other vitamins also likely to be normal. It's okay to get yourself checked for vitamin D, I would say here. Okay, next slide. Yeah, thank you very much, all of you. I hope I enlightened you. There were a lot of hitches because I think I'm a little poor with, all these. I'm yet to get adapted to this sharing the screen and sharing the slides. Okay.
No, ma'am, it
So
was
next time, thank you.
extremely informative, actually. A lot of detail of how breast proliferation happens and so on. Thank you very much. We do have a few questions already, but before I go into the submitted questions, any questions from the audience in live?
Yeah, you can ask me questions, correct.
So there is already a question on the chat from Megha Jam. During lactation, is it common that breast sizes change and with one side becoming bigger than the other, does it become normal on its own? Do we need to worry? This is a question about differential breast sizes during and after lactation.
Genetically, genetically, what happens, I'll tell you how breast develops. Breast develops from something called milk line. It is from the axilla down to the abdomen. Okay. So what happens genetically, anywhere breast can develop, but the only two buds remain in the center. And for some reason, some more tissue left in one place. So that's why one breast is bigger than the other as far as cells is concerned, number of cells. During pregnancy, the differentiation and proliferation is so high that it is likely that the breast tissue is very little more also, it will become too big. Okay. And post delivery, normally it goes back to normal. Even if it doesn't go back to normal, you don't have any reason to worry. It's just that one breast is as it is, bigger than the other one. We have seen a lot of women coming with a real huge breast on one side and small breast on the other side. Such time we do we do correction. Either we ask the patient which side breast she likes, either we augment it or we reduce the breast on the other side. This is what we do by plastic surgically, we do that. Okay, so nothing to worry. But there is something called the dense breast. That means bigger breast, big breast, more chance of getting breast cancer. You should know that. Okay, big breast people have to be a little more careful and aware, because even if there is a small lump, small change, you cannot pick up with even your self-breast examination or ultrasound. Only can pick up. Big breast, so bigger chance of getting breast cancer.
So there's another question. Is there any outfit we should avoid wearing in daily life to avoid breast cancer? Any specific outfit?
Nothing. In fact, recently we wrote an article on this bra in one of the Canada newspapers 3 days back. It came out. Here, we try to say breast is not related to bras at all. There's no relationship. The bra is only to support your breast, give a shape, and make you feel better and comfortable. In the night, a lot of questions, people ask questions. In the night, should I wear, should I not wear? If you have very comfortable bra, you can sleep, you sleep. Otherwise, it's better to remove, because it is more comfortable not to wear in the nights. Okay. But a lot of people, when they have too big breast, because it falls on the side, it hurts them. It causes pain for them. So such situations, we tell them, okay, you can wear in the night good bras, because it plays a very important role with your own comfort, and that's it. Okay.
There's one
good quality.
Yes, good quality, soft.
I would always say that, instead of going and buying 25 bras at less price, then just have 6 or 7 bras of very good quality and the best quality, because it is an investment on yourself to be comfortable, I would say, rather than just the look. Okay.
There's one question, asked about ideal age for menopause. I mean, what's the ideal, like what's the typical normal age for menopause is one question. Because you mentioned about late menopause.
Actually, there is no exactly ideal age, but more early you attain menopause, you are more healthier. 45, 48, 49, you attain menopause, it's very good before 50. Above 50, you're not attaining menopause, there is some health problem. Please go meet the doctor, get your vitamins checked, look into your nutrition, look into your obesity, get into yoga programs, get into lifestyle programs, get into weight reduction programs. Okay, get into everything possible to look after yourself as an individual and your body. You're not attaining menopause, then there is a problem above 50 if it's happening. So ideal age is between 48 and 52, I would say on an average. This is what we see normally. Above 55, if they're still bleeding, I will be little panicked about my patients. I definitely tell them that they have to meet the doctor. Yeah, when the doctor sees them, yes, like in our clinical practice, it's easy to say by a lot of these gynecologists, oh, there's nothing, you can go. No, I would say, because as a scientist, I like to think, if you see my presentation also went very scientifically to the depth of science rather than simple things. So there is some abnormality, that balance is shifted. That balance need to be brought back. Find out what is needed. That's why you see this yoga, meditation, all these ancient methods to bring calmness to us. Not to do be hyperactive with ourselves, not to do overdo things. So that has come up in a big way recently. I think everybody is picking up in a big way, even because of this COVID situation now.
Yes.
People are not coming to hospital because they're becoming more healthy. I'm happy about that. Yeah, real cancer patients only we are seeing now. All right.
Okay, that's right. If somebody is BRCA positive, is there some way of preventing cancer? Not that everyone who has BRCA positive is cancerous, no, ma'am. Actually, it was high percentage.
Uh, all BRCA positive in his lifetime, her lifetime, all BRCA positive in her lifetime, she is 99.99% she'll get breast cancer. Okay. That means she's 100% going to get breast cancer. But can I delay getting that breast cancer? By reducing toxins, we can give chemoprophylaxis, we can do subcutaneous mastectomy, we can do regular skinning to pick up the cancer at an early stage. There's no way you can prevent breast cancer in BRCA positive patients, but you can delay the occurrence of breast cancer. Okay, that is why so aggressively we treat these patients, because we know that's why Anjali Jolie is not a fool to just go and remove her breast because her mother was breast cancer patient, her grandmother was positive patient, breast cancer patient. She was BRCA positive. Just like that, she did not remove it. She knew she's going to get breast cancer. So she underwent subcutaneous mastectomy. Okay.
And also, if you do early screening or regular screening, you can catch it at very small lesion size, right? So the treatment will be more effective.
Treatment is not only effective, you can prevent chemotherapy. Maybe you can prevent radiotherapy. So the treatment is not so complex if you detect cancer at an early stage. It can just be a surgery. Okay.
This was father had male breast cancer and my age is 27. Should I go for a genetic test? BRCA2.
Worth it. Because male breast cancer, it's a high risk family. Male breast, I listed, no, you saw in my list of high risk families, one of them is male breast cancer.
Definitely, you should go for regular screening. Make sure. People have thanked the informative session. There's a question about homeopathy. Good to address fibroids. Should you go for homeopathy? I'm asking.
Actually, once you have a fibroadenomas, okay, once you have a fibroadenomas, see, either it will stay same size or it will keep growing. Okay, there is a reason it is growing. So you need to find out, are you vitamin D deficient? Is there any actual hormone problem like prolactin hormone, T3, T4, TSH hormones? And also any deficiencies present in the body. Also your lifestyle pattern, all that you check, then the fibroadenoma remains same size. But if fibroadenoma is more than 3 centimeters, it's still likely to grow because there's a lot of bulk of fibroadenoma. So that's an indication for me as a surgeon to operate you. Okay. So that's when I come into the picture, oh, you need surgery. But normally, I see in my clinical practice, maybe I see 8 to 10 women with fibrocystic disease and fibroadenoma every day, I'm telling you. Okay,
okay.
earlier I used to see 20. Now a lot of online consultations, they come with the scans. So maybe 6 to 8 to 10 patients is a lot. Maybe I'm seeing only like 8 to 10 areas in Bangalore. So they're like, let us say whole of Bangalore, there may be 25 patients every day. This is a large number. I think this number is coming because of abnormal hormone containing foods that we're eating. All these non-veg food contain hormones. These are called exogenous hormones. I give a lot of, we are actually publishing a paper also on this shortly. Role of exogenous hormones causing these fibrocystic changes, fibroadenomas in the breast. And this breast is a high risk breast. They do have a tendency to get breast cancer in the long term, in another 20 years, 25 years. So I need to work on preventing breast cancer in her or detecting breast cancer at an early stage in her. This is what we are working towards. Like every patient is evaluated to see why they're getting. And homeopathy, okay, homeopathy is one way of managing the nutrition. Okay, I would say yes, if homeopathy can control your if you can maintain your good lifestyle, I don't mind you do that. But make sure you're not vitamin D deficient. Make sure your hormones are good, because allopathy, difference between allopathy, Ayurveda, and homeopathy is that for me to come up with one tablet in the market, it takes 25 years as an allopathic doctor. That means there's a lot of pre-marketing research, post-marketing research that has happened for me to say, oh, this tablet works. Whereas in homeopathy has some benefits because they follow diet. It is all diet based. Whatever medicines they give, it could be from the, what do you call, the tablet coming from some vegetables or from onions. I've heard, because I sometimes, my homeopathy doctors are also my patients. Okay, they come and sit in front of me. I discuss, yeah, what do you treat? Where are they coming from? We read also sometimes, because we want to know, because what they do. My patients come with a lot of problems also sometimes. So what did they do? They do something, because a lot of these Ayurvedic drugs, I would say, homeopathy doesn't contain that much of steroids, but Ayurvedic medicines can contain steroids. So be careful with that. I'm not against Ayurveda, but Ayurveda has got very good lifestyle practices. They're very strict with your diet. Wonderful. I love that, because even I cannot maintain that lifestyle to my patients, but Ayurvedic doctor can do that. Very good diet, very good sleeping patterns, advices, yoga, pranayama, all this come under Ayurveda. Excellent practices. But their medicines that they're giving, they are not dosaged. The dosage is not there. And secondly, they are not studied, in the sense they are not gone through clinical trials. They are not, only few Ayurvedic products we use in allopathy also. There's something called tenocorin. You must have heard a word called guduchi. I use that a lot in my breast practice. It's used in asthma also. It's an immunomodulator. There's a leaf called guduchi. So they give it as guduchi. But if I give 500 milligram of tenocorin, basic molecule I'm giving. So if I have to give tenocorin, my dosage is 2 tablets a day. But if I have to give guduchi, my dosage is 3 times a day. You understood? You see the quantity that you have to eat to get the same effect. So this is the difference between Ayurveda and allopathy. I'm not against any of your therapies, but make sure you are evaluated properly before you go to either homeopathy or allopathy, Ayurveda. Sorry. Yeah.
Sure. So one last question. It's like amazing your knowledge that you're imparting through this. So the last question is from a survivor. She was estrogen and progesterone positive and HER2 negative. What are the precautions that she needs to take? She's doing yoga, walking, and what is the advice you can give to survivors who are either triple
So a
negative
lot
or
of
HER2 negative positive? Yes, ma'am.
okay. ER/PR positivity is the receptors that are present on the breast cancer cells. If she is postmenopausal, ER/PR positive is very good. If she is premenopausal, there is some risk that it will come back. Okay. So there is something called integrated therapy. This career group that I am one of the advisors in that company, medical directors in that company is, uh, we deal with something called integrated therapy. How you do yoga, pranayama, breathing, and what kind of diet you take. I'll tell you the difference between the way they treat in Memorial Sloan Kettering and in India. See, you must have heard when I tell my patients, I tell them, oh, I will do operation like how I do all over the world. People do all over the world. And medical oncologist will, I'll give chemotherapy like how everybody gives all over the world. That's the standard of care I'm giving. And radiotherapist also same equipments. In fact, we have better equipments than even in America now for radiotherapy, because we can afford then those, because we have numbers. So when I can give radiotherapy, chemotherapy, what is the reason a lot of these movie stars go to Memorial Sloan Kettering? The reason is, one is personalized care. The personalized care costs a lot. Okay, the patient gets a lot of personalized care. One, in the personalized care, when you get a personalized care, the complications are avoided, complications are prevented. Okay, so the complications of chemotherapy don't happen. Third thing is, the main third thing is, in fact, when Dr. Gary Deng, who is advisor of this carer group, had come to India, he's from Memorial Sloan Kettering, is integrated therapy. They believe, I am telling you now, here comes the picture of Ayurveda and homeopathy. They believe in these definite products from fruits. You must have heard this, whoever is a survivor who's talking to me and asking me the question. So you must have read, oh, there are certain fruits which prevent any cancer coming back. Okay, so like this, there are a lot of integrated medicines, integrated therapy medicines itself. If he's a gut cancer patient, there are certain medicines coming from the mushroom. So there are a lot of digestive agents which prevent cancer. I would say, in simple words, these are all what they're trying to do is they're trying to give a lot of phytogens. That is, self-killing of the death of the cell is going to increase. Secondly, there's a scientist who got a very good report. That is a Japanese report, that intermittent fasting is known to prevent cancers in the body. What does this do? When I fast, I have to eat my own body cell proteins and fats, right? So normally body tends to eat abnormal genes, abnormal proteins. Genes is nothing but it is a protein, abnormal dead cell. It will eat its own dead cell. So over a period of years, from ancient days, from ancient Ayurveda, from ancient generations, we have been telling that Sola, Somar, I don't know how many of you heard, 17 Mondays you have to fast. Then you will get a boy to get married, because you become slim, you become beautiful, you get detoxified. Okay, you get detoxified and the boy will easily selective. So there was a lot of scientific reasons behind all these things that we were doing from ancient days. So, but there was a lot of, even in Ramzan they do, right? They do a lot of fasting. This is supposed to prevent cancers.
Okay.
Okay, this was proven by Japanese scientists. Yeah. So, uh, where I was coming, so what you do not eat sweets, because cancer cell wants sweets. Okay, for make sure you lose weight if you're a cancer patient. ERPR positive is a good thing. You will be given a tamoxifen, anastrozole, or some tablet to suppress any cancer cell coming back. Because why cancer comes back even in cancer? So you may be saying, should I take treatment? I am removed with all the cancer. Because why is because once the cancer cell production starts, the tumor starts, there are multiple cancer cells are there. Not only I remove this cancer cell, before I remove it, there are a lot of cancer cells would have spread into the body and maybe sitting dormant in the body. Or the products of cancer cells, the abnormal gene may be sitting here and there in the body. It is inactive now, that cannot be picked up in the PET scan. But anytime it can get activated if your dietary habits are not good, if you're eating too much of besan, maida, gas producing foods. Okay, eat a lot of vegetables, fruits, and rice. This is a very good diet. Not chapati, roti, naan, avoid bread, biscuits, milk, avoid all that. Non-veg foods, if it is if it's organic, eat little only. You don't need that much proteins. Whatever you get in these foods, balance the diet. Eat on time. Maintain the circadian rhythm in the body. Body has something called a biological cycle. Maintain that cycle, we prevent disease. Okay? All right.
Excellent. So with that, and wishing everyone a happy diet and happy exercising and high and healthy lifestyle. Again, we profusely thank Dr. Nanda Rajneesh ma'am for an excellent, scintillating and knowledge-filled talk. Thank you very much, ma'am. God bless. Thank you so much, all. And we will continue Friday. Next Friday is basically Insta chat, and all of you can join in as well. Thank you very much, ma'am. Thanks a lot, ma'am. Thank you. Thank you.